Dean Kennedy here. You are listening to the Troops and Global on Wheels podcast hour, the place to be to learn about the latest and greatest life stories from people who are doing incredible disability advocacy work. Erin Stuckey, welcome to the Troops and Global on Wheels podcast hour.
Well, thank you so much for having me, Ming. It's great to be here.
So Dr. Erin Stuckey is an epidemiologist and program officer at the Bill and Melinda Gates Foundation, focusing on polio eradication. They contribute to the last mile of polio eradication by working with government and NGO partners to increase coverage of routine immunization and other essential health services in areas at high risk for polio in Pakistan and Afghanistan. And just for people who are not familiar with the field of I always struggle with the words, so excuse me. Epidemiologist, epidemiology. Can you just give us a brief overview of what that is?
Sure. So epidemiology, it sounds like epidermiology, so a lot of times people think it has something to do with the skin. But epidemiology is the study of infectious disease dynamics, or really doesn't have to be infectious disease, it's just health dynamics. And so as a medical doctor focuses on an individual patient. So what's going on with you or with me, diagnosing, treating, and what's happening within our bodies. Epidemiologists look at population as a whole. So we can say, okay, well, what's going on in this group of people? Or for a specific disease, who is getting this disease? Where? How is it being transmitted? So it's kind of population level rather than individual level.
So that's fascinating. Thank you so much. Because I know our listeners are, some of them will be unfamiliar with that. And so moving on to the Gates Foundation and what was their impetus for wanting to eradicate polio? What got them started on this whole issue?
I think that until then, when the Gates Foundation got started kind of in the early 2000s, the GPEI, so Global Polio Eradication Initiative, had already been going on for several decades. So Bill and Melinda, so our co-chairs, wanted to get involved. It's making sure that we can have a polio-free world. There's a lot of resources, a lot of effort that goes into programs, and it's important that that we can finish the job to have a polio-free world. I think it comes back to the equity problem, and it's the right thing to do, and it is possible.
I was thinking that it's just so important for all these, organizations, foundations, whether that be Rotary or Bill and Melinda Gates Foundation, to really put a huge amount of funding and human resource into this issue. As you may know, I contracted the virus when I was a toddler, and so it's definitely something that still affects people, as you know very well, albeit a much smaller number, but it's still in existence. And so moving on to polio eradication. So what two countries do we still see cases of polio, and why has it been particularly difficult to eradicate it from these two regions?
So we have cases remaining. There's only two endemic countries. That's Pakistan and Afghanistan. And we just earlier this year, a couple months ago, actually in August, the entire Africa region was certified wild poliovirus free, which is huge. This is incredible. So it's certified by the World Health Organization. And I think that at the beginning of the partnership, it seemed like such a long road ahead, but I think that goes to show that it is possible to finish this job in the last two places. And what's making it really difficult is in both places, especially in Afghanistan, there's the continuing insecurity that's going on. You know, there's been fighting, there's been war there for such a long time, and that prevents access for campaigns, and not just campaigns, but the routine health system. So people aren't able to access the routine vaccinations that they need to keep them and their communities healthy. And so what happens when we don't have high coverage for routine system, we have to go in with campaigns. So during campaigns, someone knocks on your door and they have the oral polio vaccine drops, and they're vaccinating young children. And to do that, you have to do that over and over and over again. It's really difficult in these places to reach every last child with these campaigns. So we're seeing that there's not that population level immunity that we need. But again, it is possible to do this, and we're trying to shift our strategies accordingly. And so that involves, for example, working more on the routine systems. So in some places, it's not allowed to do house-to-house campaigns. So then we have to kind of adjust and strategize for how can we reach children. And then it becomes even much more important to really center on the communities that are experiencing polio infection, and really understand, you know, for each case, you know, what is this community like? How can we, why are they not being accessed by the campaigns, and how can we work with them and with the community leaders to improve that access? So it becomes even more important to focus on the individuals.
Mm-hmm. Yeah. So what were the crucial factors that helped, polio get eradicated from Nigeria and hence Africa at large?
You know, in terms of finding every last child, that's been important. Another crucial, really important factor was making sure that communities are invested and really are bought into the need to implement these programs and to finish the job. So there's been times when polio and the campaigns have been used kind of as a political tool. And really it was the work of all the organizations working with the communities to make it hand in hand, to make sure that this is something that that leaders recognize is important to the health of their communities, and there's benefits to them as well. And so we're lucky at the moment that, you know, polio is not being used in that as a tool in that way at the moment. And so at this point, it's working with all of the partners, with the governments in the two remaining countries, to have solutions that are encompassing all the parties. It's not something that is anyone's agenda except for the health of the population, and so we're working through that.
Yeah, and just following up from a point you just alluded to, so what resources and attitude changes needs to happen for these last two countries in order to help get polio eradicated faster? So I know in Nigeria at some point, the reason it took so long, one of the reasons, obviously it's a complex issue, was because of misconceptions about Western education and culture as well.
Yeah, absolutely. So I think there are definitely refusals among communities. I mean, the same thing as in the U.S. There's people that don't want to accept vaccines. I think that's going to be the case pretty much anywhere. But I think that it's so important to, again, going back to this, working with communities and being really in tune to what their concerns are. People refuse for a number of different reasons. Sometimes it's because it's misconceptions, like you mentioned, like they don't trust what's in that vial, that there's somebody coming and knocking on their door and wanting to access their precious newborn child. So that's one element. Another that's really common is that there's a lot of communities that have been marginalized and not have resources from the government for a very long time. And so let's say like they don't have access to safe drinking water, or the road that's between where they live and the main access point, that road hasn't been paved. Or there could be or there's a health facility, but there's not medicines available. So a lot of times what we hear we call those demand-based refusals, which are people are saying, like, why should we accept this vaccine when you keep coming to our door, except all you come with is polio vaccine. What about all these other needs that we have? People's needs are really varied, and it's not possible to provide everything at once. But a lot of times we get refusals based on that. So that's why it's really important to adjust a strategy. It's important to work with communities and try to understand how best we can address their needs where possible. So polio in general has been fantastic at being able to pivot, for example, for the COVID response. And being all of that workforce, all the frontline workers were able to, instead of going out and looking for polio cases, they were involved with providing information for communities for COVID to make sure that there's not that misinformation out there. There's polio workers that were involved in testing and doing contact tracing and all of those things. So there's been quite a lot of other ways that the polio program has been able to support communities, and so we're always looking for opportunities to connect the programs as much as possible, so that this workforce and really the program is a benefit to countries in the long term, long after polio has been eradicated.
I don't know how others feel, but just from looking at the news, it seems like countries are working on a country-by-country basis to come up with a vaccination. What about collaborating together to come up with a vaccine that works for everybody around the globe, regardless of which country you're in? Do you have any input or insight to add to that?
No, absolutely. That's such a great point. It is so incredibly, and it's really important. It is incredibly important that the world as a whole is able to work together collaboratively. And if everyone kind of goes off in their own corner and says we're going to do this alone, it's going to take longer. It's going to be more expensive, and also we're not learning from the countries that really have experience in these areas. I mean, we saw for COVID, for example, there are many countries in sub-Saharan Africa as well as Southeast Asia that had a much more timely response to COVID than the US, for example, did. And that's because of experience with other outbreak situations. So if we don't have this collaboration, then we're missing out for everyone. And I think also I wanted to point out the Gates Foundation recently released their Goalkeepers report. And Goalkeepers it takes a look at that overall progress on certain human development and health indicators and how we're doing on these things. And one of the things that came out is they did some analysis and some simulations about for the COVID vaccine, what would be the lives averted or lives saved if every country kind of had their own vaccination plan versus a vaccination plan that was equity focused, so targeted towards the folks that need it most. And there was a huge difference in the lives saved by going with the equity approach. So it really is better for everyone to collaborate.
In terms of what about the structures in place in terms of systems that enables countries to be able to collaborate well together on global health issues? What are they, especially given, the relationships that the U.S. has affected in recent months?
Yeah, there's a number of different global mechanisms or global bodies. For polio, I mentioned the Global Polio Eradication Initiative, and so that is the Gates Foundation, it's Rotary International, the US CDC, the World Health Organization, UNICEF, and Gavi, the Vaccine Alliance. And so that's one way that for the polio program, there's committees, there's for everything you could possibly think of, there's a committee, and everyone is involved in it, making decisions and making policy, and it really is it is a partnership in the true sense of that word. For the global, in other contexts, so there's the World Health Organization that really takes the lead in developing guidelines, policies when it comes to health, and country governments really look towards the WHO for guidance on those elements. Otherwise, there's also grassroots efforts. There are plenty of activists. There's plenty of NGOs. There's lots of different ways that these folks can come together and make sure to influence policy in that way. I firmly believe that you need all of these different actors, and everyone has a role to play. If you can't only have governments, you can't only have multilateral organizations, you can't only have NGOs. It's important to have that dynamic, and everyone kind of keeps each other, making sure that we're not forgetting everything. And it's not perfect, and everything doesn't work exactly right all the time. And I think that as long as we're focused on moving forward, that it's helpful. It's definitely way more difficult when we don't have support of governments for certain institutions. So, it's difficult to say kind of what the future will look like. I'm very curious to see in terms of what's going to come out of COVID, and hopefully once polio is eradicated, what does the global architecture need to look like moving forward? How can we make sure that everyone's needs are met, and people that are and people and agencies and different institutions are able to contribute? Because I think once things get stagnant, it makes it more difficult to make progress. So there's always an opportunity to kind of turn that lens inward, and it's important for everyone to do that.
Exactly. And so last question here, given I'm sure you're aware of the controversy and, all the drama surrounding U.S. relations and WHO, what can you speak on in terms of the effectiveness of WHO in tackling global health issues such as the coronavirus, and, talk about it really from your experience with the Bill and Melinda Gates Foundation and the various health issues that you've worked on, polio, malaria, other things.
Yeah, and I do want to say that we don't know what the impact will be yet of any changes for the WHO, and in terms of what the U.S. support will or won't be for that. I think that's not something that anyone can speak to at the moment. But I will say that the WHO has an absolutely critical role and has been leading the efforts in a lot of ways in many of these disease eradication efforts. So they're a core partner of GPEI. They're, in the Pakistan program, for example, they're all of the partners are in the Emergency Operations Center. There's a core group. WHO is certainly there. They're taking the lead with a lot of the elements of the work for both the campaigns as well as strengthening the routine immunization system. I think that's a real benefit to what WHO can offer, is they do have that broad-based knowledge to be able to connect kind of the individual campaign efforts with the broader health system approach. And for malaria as well, WHO has been certainly a champion for malaria programs worldwide, and the Gates Foundation works really closely with the WHO on malaria, and will continue to do so in the future, especially when it comes to making sure that there's policies in place at the country level, at the global and the country level, to help to make sure that programs can do what they need to do, and that the health systems of countries are taking the most recent knowledge and evidence and all the good technical stuff into account and can apply that into practice. So that's the role that the WHO takes, and it does help that it's an organization that is not tied to any one specific country, that it is something that is there for the world's benefit.
Thank you for emphasizing that, in helping us understand what an important role, the WHO does play in the global health. Anyways, you've been very eloquent and very insightful. Thank you so much, Erin, in helping us understand the field, the word that I can't pronounce, the field of epidemiology. So I really appreciate it, and I know our listeners and viewers well. too.
Thank you so much, Ming. I think your podcast is fantastic, and I cannot wait to see all the other interviews that come out. So thanks for doing what you do. It's really fantastic.
Did you like this video? If so, share with your friends and be sure to follow us on social media. And if you want even more resources, be sure to sign up for our email updates on our website, traipsingglobal.com. Keep learning new perspectives, keep being inclusive because it will make the world a better place for you and for everyone else. Thank you so much for watching, and I'll catch you on another episode of the Traipsing Global on Wheels podcast hour.